And so like, I mean, I have no idea what I was doing. I just like bopped my kid on the back of his back until he like kind of came back into like, took a deep, like, until he like inhaled. But like, what can parents do? What's helpful?
So, trying to stay calm, which I know is easier said than done, but, if you can stay calm, that will sort of help the episode pass quicker. I think actually maybe, I also patted my child on the back until he was completely jolted. I do think a little bit of sort of jolting them can be helpful. You're almost reminding them to take a breath. If they do lose consciousness, which again, it does happen in most of these episodes where they lose consciousness, even though, as I mentioned, there's no danger inside the body or the brain or compromise to the nervous system, you do want to protect their airway. So you would just want to make sure that they're in a position where their breathing is fully sort of accessible, right? Like their nose is not covered by something. So if they were to fall into because sometimes children will literally fall to the floor. If they were to fall onto a blanket or a pillow, you'd want to make sure to turn them over. And then again, some children really even do have stiffening or almost shaking that can look like a seizure. And while it's not a seizure in the same sense as a child who has a seizure disorder, similarly with that, you would want to make sure you're protecting the airway. And that would just be making sure they have, a full sort of breathing space around them, staying calm, being there to reassure them when it's over. And then, remembering that this is transient and typically it resolves in children by about age 5 or 6.